And then we move into the third trimester. Oh. At this point, again, the incidences of miscarriage are even less than we had in the second trimester, which was far less than we had in the first. At this point, the mom may be putting on 1 pound a week. Much of this is fluid. Much of this is not fetal weight. But the baby is inside a fluidic sac, the amniotic sac. And so that all takes up weight as well. So you figure a gallon of water would be 8 pounds. The baby may be another, at this time, at the beginning, 5 to 7 pounds, or 5 pounds. And so we've got 13 pounds that's just in the belly. We've also added a lot of density to the omentum, the belly fat, to maintain the stability in the stability and temperature in the abdomen. And so that takes weight. So it's not just fat that she's building. The baby is growing, the fluids around the baby are growing, and the fats of the body are growing in order to protect the tissues. There is an increased strain on circulation as they have a lot more blood to circulate. Kashyapa Samhita says the mother may notice a decrease in energy and a change in her complexion at this time. So she had that pregnancy glow. Now she looks a little bit tired. Her body's doing things. Her body is growing and developing, and the fetus is growing and developing. And if she's not nourishing and nurturing her body in the way that she should, this is going to be a really hard time. She's going to feel a lot of the exhaustion. If the woman spent that mid-trimester go, and not revitalizing the body, then she pays for it in the third trimester. So even though we have all this prana, we have more energy, we want to remember that we do the activity and then we restore. We prepare for the activity, we do the activity, then we restore. And it's very important for pregnant women to continue this as well. The mobile quality. The baby is big at this point. The organs have moved out of the way for this developing womb. And so the small intestine's been pushed up and the large intestine's been pushed out, and the liver's been pushed up into its corner, and the stomach's got some pressure on it, the bladder's got pressure on it. So the digestion and the circulation can all be impacted during this time. The baby may be active at different times of the day. It may kick, it may push. Sometimes you can see the outline of the foot or the outline of the hand. And the movements, this is kind of fun. I thought this was just hysterical. Around about 7-8 months, because the baby's so big, when it moves, you can see the movement from the outside. So it's not just that the mother can feel it, but an observer would be able to see the movement of an elbow or see the movement of a foot as the baby is moving. And I always thought that was magical. I love that part. The mother may have to pee a lot, and she may have to get up at night to go as well. She feels she can't empty the bladder completely, but also the fetus is resting on the bladder, making the volume that it can hold less. So she may feel urgency quite often and go up to pee and just be able to pee a very small amount. And she's not really not voiding the bladder completely. She's getting the signal to pee before the bladder is completely full. So both of those things can happen. Some of the gunas that are present in third trimester, we have soft. The tendons and the ligaments of the entire body soften to allow for delivery of the baby. So we have tendons and ligaments in the hip joints, and they get softened so that the hip can expand to allow the movement of this large being out of the body. For sweet taste, Vata women, richer foods can help build the ojas of the baby and the mom. And remember, sweet taste is coming from whole grains, root vegetables, winter squash, sweet fruits, not so much from pies and cakes. Excuse me. For Kapha type women, avoiding simple carbs and sugars to avoid having a larger baby. The simple carbs and sugars break down too quickly. If the sugars are not absorbed into the cells rapidly enough, we get high blood sugar. This feeds a diet that's rich in sugars to the baby, and that's going to cause the overgrowth of tissue. Salty foods may cause water retention because where sodium goes, water follows. So Kapha women are looking to include, they can still include all those great sweet tastes, The root vegetables, the winter squash, the whole grains, they just do smaller portions, and they avoid the simple carbohydrates that they might find in cakes and pies. Flours and sugars are off the table. Sour foods nourish the baby, pacify vata dosha in the mom, and stimulate the building of blood and the metabolic function of the pitta time here. Oh, I'm sorry, I'm in vata time now. My tissue and dhatu management system, the Shratamsi, we got Vyana Vayu. Vyana Vayu is responsible for circulation. We may have some stagnation in circulation. The risk of varicose veins and clotting increases. So what does that mean for the mom? It means that she wants to spend time, legs up the wall or with the feet elevated. If she's driving for a long duration, she wants to get out of the car and do some exercise and kind of support the body to keep circulation strong. Varicose veins are veins that have had damage to the valves, and so that they can't contain the blood that's within them. So in order to encourage strong circulation in the lower extremities, we would look at, they might want to wear compression socks would be one thing you can do. Avoid sitting with the legs crossed, because crossed legs cause stagnation in circulation. Be aware of and watch out for water retention. This can happen with pregnant women who stand a lot. Remember, gravity is going to be a huge factor. Their body is pumping 50% more rasa and rakta through that circulatory system. And so if they've been really active, if they did exercise during the first trimester, they will struggle less with this during the third trimester. So truly, when we look at that kapha stage, the things we do to balance during the kapha stage will pay us back during this third trimester. If, however, now they're seeing at the end, they've got a waitressing job and they've been on their feet all day and they come home and their ankles are swollen, that's when they really want to get the legs up the wall, elevate the feet, and allow gravity to support them in bringing the fluids back to the heart. And then if they can, do passive exercise or even gentle yoga stretches and things will help to keep that fluid, the rasa and the lymph, in the bloodstream, keep it inside the vessels so that we don't see the edema or the swelling, and we have less pressure on the veins for varicosities. It says pay close attention to the thigh just above the knee joint. This is a problem area. And this is on the back of the leg. So if you look for, like if you put your leg out straight, you feel where the knee joint is, and you come up about 3 to 6 inches above that. This is a region that often creates varicosities or where clots may form. If a person is on a long plane flight, they want to get up and walk around. And it's one of those things, the card that's in the back that gives you, in the back of the seat in front of you, that gives you instructions for how to keep blood moving during a long flight. That's there because of someone getting clots. It wasn't necessarily a pregnant woman, but she got a blood clot after a long flight, and she said they should have told her that. So it's very important to point the toes, flex the feet as you're sitting in your seat, and take breaks where you're walking for 5 to 15 minutes up and down the aisle. And nobody minds seeing a pregnant woman do that. If they get a long car ride, take a break, get out, take a walk, do some stretches, do some exercise, feet up the wall, compression stockings, massage the legs. And it says, provided there's not deep vein thrombosis. And you won't know if there's deep vein thrombosis unless you see some significant swelling in the leg. And if you see that significant swelling, you want to refer them to a medical doctor. Because deep vein thrombosis and even these superficial clots, if they move, can become problematic. So anytime there is redness, pain on pressure, you might want them to mention it to their OBGYN. From John's wife, Natalie. She was sitting cross-legged on the floor on Christmas morning, opening presents, playing with the kids. And this was in the 8th month, the varicose vein developed on the leg. And it says it's a genetic thing. All the women in her family have them during pregnancy. Varicose veins really are genetically traced. So if you look at your parents' legs and you don't like them, take care of your legs now to minimize the potential of expression. So she was sitting on the floor like that for 4 to 5 hours without moving, and then mixed that with the heavy food of Christmas, and she developed a clot in the varicose vein. I wonder if she'll tell us more about that. She woke up the next day to throbbing pain in the leg. And she did then got to her doctor. She said, okay, this is not good. I've got this pain. It's in the area of a vein. Let's find out what's going on. The doctor was able to tell her it was a superficial clot. And he advised her simply keep the leg elevated, apply warm compresses, which would allow the clot to break up a little bit, and keep moving. Keep the blood circulating, because that's going to be an important, the body does have mechanisms for breaking down blood clots. It does that on its own. And so it's so important, she mentioned, especially with varicose veins, keep moving, don't apply extra pressure like crossed leg position, and keep the legs elevated when you can. So all these are really good. It's really good advice throughout the entire pregnancy. But it becomes very important in the 3rd trimester to pay attention to the presence of varicose veins. You would still have the mom doing abhyanga in the mornings. So paying attention, we go circular at the joints. But so if imagine this is the back of my knee, I want to get a lot of friction in that straight at the foreleg, straight shots or straight strokes on the thighs, but I also want to pay attention to this joint and make sure circulation is happening. We spend a lot of time sitting, and we spend that time sitting with our legs like at 90 degrees or with the legs crossed or with the legs bent. And this can be problematic for circulation. So it's especially important for pregnant women to pay attention to how much time are they spending sitting, and look at walking for 15 minutes of every hour. If they're sitting down, not really doing anything, they want to make sure they're moving around, increasing circulation. So we're doing the abhyanga in the morning, we're putting the legs up the wall in the afternoon, and we're walking during the day. Looking at the anavahashrotas, and this is a great picture of just what happens with the organs as the fetus is developing. They all get shoved out of the way. And that's as it should be. The baby gets that predominant space. But now what's going to happen with the stomach and the anavahashrotas? It's going to become full more quickly. The baby is encroaching on the area of the stomach, making its capacity less. So the mom may need to eat more frequent, smaller meals. She may experience heartburn as the esophageal sphincter is softened because of the progesterone. So now when the stomach contractions occur, it forces that acidity up into the esophagus, and so that heartburn comes up. It's not usually a situation where she's created excess acid. It's that the acidic contents of the stomach, which are as acid as they need to be, are being pushed into the esophagus, being pushed away from the stomach. With the rasa, gestational diabetes may occur, doesn't occur for every woman. This is a diabetes that develops while pregnant. It can affect both mother and baby health. It does not create a child born with diabetes. What it usually creates is a child who's born with hypoglycemia. So the fetus has been developing in this sugar bath. There's lots of good sugars around, always plenty of sugar in the diet. And then it's born and it's living on breast milk, which has a good quantity of sugar in it, but not as much as it was getting in utero. And so the child may experience symptoms of hypoglycemia, always being hungry and never getting enough. There are some instances where you see diabetes, type 2 diabetes in these children. It doesn't tend to have any relationship with type 1 diabetes presentation. In most cases, there are no symptoms. The typical symptoms we see with diabetes is an increase in thirst and an increase in urination. And those symptoms don't typically present in greater quantities during during pregnancy, the time period of gestation. It is a typical test that's administered at the beginning of the 3rd trimester. If the woman appears to be gaining a lot of weight, or if she's experiencing some types of symptoms, I'm not sure exactly what all those would be. It might be recommended earlier. Mentioning my pregnancy again, I was older. I was an older mom. I was 43 when my son was born. So I was watched really closely for a lot of things. So I was tested for gestational diabetes. At the time I was in the 3rd trimester, I was being monitored every week for fluid levels. And that was for the baby's fluid levels. And so that was having to go and lie for an hour with a baby monitor on in a hospital setting where they were measuring the fluid levels around the baby and his movements and things like that. So it was once a week I would go in for that. So it just depends. Some people will present with symptoms. For other people, they may not have symptoms, but they may be in what they call a high-risk pregnancy, like an older mom, and they do this monitoring as a matter of course. So even if there are no symptoms, if the woman is being seen by a registered nurse midwife or being seen by an OBGYN, she may go through these tests. If it presents itself, if gestational diabetes is present, they would look at healthy diet, increased exercise, and regular monitoring of blood sugars to see if they can do anything to reduce that. In some cases, insulin is advised. I have a friend who had gestational diabetes with her first 2 pregnancies that was managed with diet and lifestyle. With her 3rd child, they put her on insulin. So and then as soon as the pregnancy ended, blood sugar level came back and she's not diabetic now. With the increasing risk for type 2 diabetes later in life, that's going to be for the fetus if they don't manage the hypoglycemia. So if diet and lifestyle, they manage the hypoglycemia, there's no increase in risk. But if they don't manage it, hypoglycemia is often a precursor to the hyperglycemia. With RASA, preeclampsia. Eclampsia is a critical condition that occurs at childbirth. Preeclampsia is a complication that involves high blood pressure during pregnancy. So preeclampsia is during pregnancy. Eclampsia, if it's going to happen, happens at childbirth or shortly thereafter. When there is high blood pressure, you may observe it as swelling of the hands, the feet, and the face. What the doctors will test for is protein in the urine, another standard thing they're checking for every time you come in, a dipstick to see if there's protein in the urine. There shouldn't be any protein in the urine, and if there is, that means the body is dumping protein for some reason, and they want to stop that as quickly as possible. If a woman has preeclampsia, that begins after week 20, which is about midway point in the pregnancy, and what you see is an elevated blood pressure that's going to come up. Now, we know blood volume has increased, so one of the factors regulating blood pressure has increased just because of pregnancy. So it is common for women during pregnancy to show an increase in blood pressure, and then they're at the onset of this increase in blood flow, and the body accommodates for it and brings it back down. So for some women, if this doesn't come back down into the normal range, they would be identified as having preeclampsia. And they may manage this with medication, they may manage it with diet, lifestyle, they may simply observe what's happening. As soon as delivery occurs, they're going to be watching the mother's blood pressure. They may even do a C-section so that she doesn't go into labor. Here we go. The most doctors require moms to get a vaginal Strep B test sometime between weeks 35 to 37. Babies are born typically between weeks 38 and week 40. Strep B is a bacteria that colonizes in a woman's vagina. And if possible, if it's positive, in a vaginal birth, it would be possible for her to pass this infection on to her child. And see, the risks increase if the mom has the following symptoms. If she labors or ruptures membranes before 37 weeks because she may not realize she's got this colonization of Strep B, or if the membranes rupture 18 or more hours prior to birth. The rupture of membranes is, when people say their water broke, this is the amniotic sac is the membrane that's holding the fetus and all the amniotic fluids. When that ruptures, that's when the water flows, the amniotic fluid flows out, and now the fetus isn't as well protected as he or she was during the pregnancy and swimming in that amniotic fluid. So the risks to the child for exposure to this Strep B bacteria increase if this occurs early. The challenge with the Strep B bacteria is the end results is if this gets into the fetus, if the fetus gets it, they get the strep in the mucous membranes of the eyes, and it can result in blindness. Typically, it affects mucous membranes, and so they can get respiration problems. So there's a lot of dire consequences. So oftentimes, moms are required to get the Strep B test sometime between week 35 and 37. If the Strep B is present, it's advised they take antibiotics until the birth, and then that usually takes care of any problem. I want to mention something here with this because I had the Strep B colonization, and I was having a home birth with a nurse midwife, and I had the choice, because I didn't have to do this, but I did have the choice, and I opted for antibiotics at birth so that I wouldn't expose my child to that. And then after birth, had to go right into restoring of the probiotic population, making sure he was going to get plenty of probiotics through breast milk. And he ended up being really colicky and having a hard time kind of establishing that healthy colony because of it. So I didn't like the fact, if I could have done it over again, I would have wanted to test earlier and had gotten all the antibiotics out of the system before it got into him getting deeply exposed to those, because babies don't build that probiotic population until after birth. And so I still had too much of the antibiotic in my body and wasn't able to provide him with the good gut flora right off the bat. So that's one of my considerations now with this is, okay, what can we do to restore that gut flora in the mom and vitalize the child's gut right off the bat? He's 16 now, it's fine. Let's see, the tissue management system, Shratamsi, subdosha. If there's let's see, we got a fever while in labor. Oh, this is all along with the Strep B. There may be a fever while the person's in labor. They might get a urinary tract infection while pregnant because of the Strep B, or if they have previous babies with Strep B, they get the antibiotics. So it says if they test positive, they want to give antibiotics, which can disturb the developing immune system of the baby. Babies' immune systems are largely immature, and then they build during that first year, especially with the exposure to breast milk and the mother's immunity as well. And this is good news. New studies showing that it may not be necessary to dose with antibiotics at this time. So that's good news. And it says here, another great reason to work with a doula to get guidance on decisions like these and do your research. You want to make the best possible decision for yourself. My comment to people is typically, how afraid are you of the outcome of this consequence? Because if you're going to be in labor questioning decisions you've made, if you're going to be in labor projecting fear into the outcome, you're more likely to manifest it. So if someone says, no, I completely trust what I read and this is the decision I'm going to make, and they are comfortable with it, great. But if someone says, no, I made this decision kind of under pressure from somebody who told me I shouldn't do it, but I'm nervous about it, then I'm going to support them to make a decision that they feel comfortable with, even if it may be a decision different than one I would make for myself. For me, again, I just looked at the consequences and they just seemed too dire. I thought it's better I can build the immune system. I can't replace blindness. So it was, for me, that was my decision. Or I would have been worried throughout the entire labor that, oh my God, I've made this decision and my baby's going to be born blind. And he wasn't. With MOMSA, hormones preparing for labor loosen all the ligaments. It's easy to overstretch, damage ligaments at this time. It's also easy to fall. It's hard to maintain your center of gravity and center of balance. The ligaments that used to be really tight and kind of help you to stand upright are no longer doing that job. So being aware of that is very important. The vagina starts to open up in the months before the pregnancy. So a tube that was like this, or more like this, now goes like this. So it's being the part near the cervix is opening up so that the baby will have that, can move into that region. The head will drop into that region to support preparation for delivery. Having soft ligaments and tendons can make it really easy to pull a muscle. So a mom wants to be careful while she's pregnant that she's not overstretching muscles, that she's paying attention to the limits that her body sets and not overexerting. With the metadatu, there may be lots of weight gain towards the end. The baby is basically fully formed at 35 weeks, 36 weeks. And then it just adds on fat, builds tissue, increases ojas. With the osteodatu, soft ligaments and tendons make it easier for the joints to be out of alignment. Again, you're more likely to fall or to just not be as stable as you were earlier on in the pregnancy. Add to that, your center of gravity now is shifted and you have a lot of this weight in the front. There's a lot of challenges that the mom's going to face. With Mutra, pressure from the large baby in the uterus causes frequent urination, often incomplete emptying of the bladder because they may be pushing on the bladder in certain ways. A urinary tract infection can develop. So it's good for the mom to just drink lots of water, create lots of urine. She'll be going to the bathroom all the time, and just let her know that that is not going to continue forever. But for right now, that's very important to keep the system clear and flushing so that we're not stagnating urine in the urinary tract. If water retention is an issue, you could bring in mild diuretics, such as the CCFT, the cumin, coriander, fennel. Coriander is the strongest diuretic of the three, but this can be taken in, you want to keep it kind of low dose. Some of these fennel can be a uterine contractant, and so you don't want to use too much of that. But the amount you'd use, like if you use a tablespoon of seeds in a quart of water, you're not going to have any kind of negative consequence with that. But it will also support flushing out the system, supports the cumin and the fennel, support the digestive process. So it's only going to be good. Parescia. Many pregnant women experience hemorrhoids. A hemorrhoid is a varicose vein. It's a varicose vein in the anus. And so in the same way the woman experiences varicose veins in the back of the legs, she might experience it at the rectum and the anus as well. This occurs because of stagnant blood. The progesterone is slowed down. Peristalsis, there may be more constipation. The woman has more weight sitting on the rectum. So if she's sitting upright, imagine yourself on the toilet for a moment, and now you've got a baby that's putting weight there. All of this weight is pressing down on the rectum. And so it's difficult for elimination to occur. Peristalsis is slow. And what I have moms do, as soon as they know they're pregnant, if they're not already using a squatty potty or some kind of stool to lift the legs up while they're eliminating, then I want them doing that all throughout pregnancy, because it takes the pressure off of the rectum and it minimizes the incidence of hemorrhoids and these varicosities. Some women get these incredible purpley stretch marks. Stretch marks may suddenly appear on the lower belly during the last 2 weeks of pregnancy because of the shift that's occurred. The baby may have been carried up high before and now it's carried lower. These striations will typically minimize after delivery, but they appear kind of silvery and present. The more purpley they are, the more it's a particular condition, and you can keep the skin supple if you've been using lotions on it all throughout. That will minimize this, but it may not completely eradicate it. And not every woman experiences stretch marks. I have no stretch marks from pregnancy, and I was pregnant. So it's like, it just depends genetically. And I don't remember about my mother, so I can't go back and check that. With the Agni, we get Vata type of digestive problems, typically because everything's being crowded out. There's just no space for the digestive process to happen really fully. The baby pushes against the intestines, against the digestive organs, the liver's out of place, the stomach's been crunched up. So everything's happening there's a lot of discomfort in digestion at this time. As far as elimination, she might be experiencing constipation because the progesterone slowing peristalsis. There may be more gas and bloating because of samana vayu imbalance with the limited movements through the small intestine. It mentions here that tomatoes may be helpful for stool softening, providing a little bit of sour taste to support the liver. One of the things, I mentioned this earlier, and I'll say it again, I'll say it 100 times, fiber, oil, water. Making sure there's adequate fiber in the diet, low quantity of processed foods, low quantity of flours and breads and things. These are all binding. You've heard of the brat diet, bread, rice, apples, what was it? bananas, rice, apples, and toast, 'cause I know it's in there. Those things are binding, and they create kind of a block flow through this Parishabhaha Shrotas. That's going to worsen the body. So I would avoid those binding foods, but I would incorporate foods that were fiber rich. I would incorporate adequate oils in the diet. And that could be up to 3 tablespoons a day. So along with good soluble fibers. So if I was having for breakfast some oatmeal with some ghee and spices, that's going to give me good fiber, good oil. I'm going to drink a cup of tea with that to get me good quantity of water. That's if I have that kind of food throughout the course of the day, if I'm aware of fiber, oil, water, I will keep the stool soft and it'll be easier to pass. And then the other thing, keep the stool soft and squat to poop. Get one of those squatty potties, the stool that brings the knees up so that you can have elimination where you don't have the weight of the baby resting on the rectum. I knew some women during pregnancy, this is going to sound kind of funny, but they actually got like a chamber pot, and then they would be in the bathtub, they'd have the pot underneath them, and they would be literally squatting to poop because they felt that that was the way they felt like they got good, better elimination. The other thing is, if you can practice squatting during the pregnancy, even if it's apart from pooping, this helps to support the body for optimal position for birth. So that squatting to poop may just be training for squatting to deliver a baby. With the Agni, a hiatal hernia might present. A hiatal hernia occurs when there's a weakening in the diaphragm and the part of the stomach protrudes through the diaphragm and causes problems. You might also see acid reflux, which is that weakness of the esophageal sphincter, and it allows acidity up into the esophagus. The person might be really hungry, but they have no room in their stomach to eat, so they're kind of eating all day long. And when we eat all day long, it makes it difficult for our digestive process to be complete. So if they can take foods that are easy to digest, what I usually recommend is think of absorption over digestion. I don't need to have a strong Agni necessarily to absorb the nutrients from a soup, but I may need to have a strong Agni if I'm trying to break down something in a food that's less moist. There are some foods which are very helpful to ripen or soften the cervix. The cervix is the part of the uterus that's the opening. It's muscular and it's thick. Ripening the cervix occurs at the end of the pregnancy, and it expands. It becomes very thin and it goes across. So imagine the uterus, say, is the size of a pear. If you had a little cap on the end of the pear, that would be the cervix. Now the uterus has grown to be the size of a large, I'm going, butternut squash, bigger than a butternut squash, a watermelon. And what's going to happen with that cervix? When it was on the cap on the end of the pear, it was dense muscle, and now it has to be stretched across the lining of this entire watermelon, the head of the baby. And when the cervix softens, and let's see if I can think of the word for it. No, it's not going to come to me. But as the cervix softens and it gets much, much thinner across the top, it's preparing for dilation. Dilation's when it opens. And so first it softens, and this is called the ripening or the softening of the cervix, so it spreads. They mention here dates, pineapples, or even spicy food. I would use spicy food with caution in a mom who's experiencing a lot of acid reflux, because she won't have the protection in the esophagus, and that can get some burning problems. But dates and pineapple don't tend to pose those challenges. If digestion is strong and she wants the spicy food, go for it. Constipation, there may be a buildup of ama. That's going to happen, so try to keep that clear. If we have ama, we might have asynchronous or unproductive uterine contractions in labor. So this paragraph here has a lot of things piled up into it, and then using sour foods to soften the stools. Let's back up to, with ama in this digestive system, this is all going to be what's being governed at labor and delivery is governed by apana vayu. So if there is ama along this channel and it's interfering with apana vayu, we get this the labor contractions being asynchronous. Labor contractions are meant to be synchronous as far as we have one, the next one is stronger, the next one is stronger and sooner, stronger and sooner, stronger and sooner. So they go through this cycle of increasing strength and increasing frequency. If ama is present, the body doesn't get clear signals, and we may have some that are not as strong as they need to be, or they're not coming at the right time. And this can lead to unproductive uterine contractions, which is a lot of discomfort for the mother and not a lot of movement along in the pregnancy. So it will make for a longer pregnancy, a longer labor and delivery. Using sour foods to soften the stools, the sour foods will help increase the digestive fire, and that's going to help the body increase digestive process and help things move through a little bit more quickly. Vata is aggravated at this time because it's done. It's ready to go. It's ready to move and transform and move from being a pregnant mom into a mom that's holding the baby in her arms. Ojas is being transferred from the mother to the fetus in the 8th and 9th month in order to prepare the baby to hold its ground outside the womb, although they're not fully ready to hold their ground for another. They have the 4th trimester, which is going to happen outside the body. But they do notice that at this point, if the mother's ojas is low, then she doesn't have the ability to pass on ojas to the child. And so keeping the ojas as high as possible, and that could be incorporating things like chavanprash or dairy foods, dates. These are all ojas building foods. With the mind, mom wants to feel really mentally prepared, supported to give birth. She wants at this time, now she might have in the 2nd trimester taken a look at a birth plan. What were her dreams and her vision for the birth? At this time, she takes that birth plan and she makes it real. Like if there's certain music. I love the Mahamrityunjaya mantra. It's a mantra that's classically chanted at transitions. That's the, some people refer to it as the Om Triambakam. But I always resist that because I think it's like calling the Bible the in the beginning, but it's that mantra is called the Mahamrityunjaya mantra. And it's a mantra of transitions. So I had a CD that had 108 of those, and we just had it on repeat, and that was going the whole time. So the mom wants to have what's going to work for her. She wants to choose whatever kind of music she wants to listen to. Another friend put together a CD for me that was music to give birth by, and it was lovely. And I listened to that while I was in labor, but at the time of birth, I had the Mahamrityunjaya. She wants to decide who's going to be in the room and be comfortable with that decision. She doesn't want to be pressured by anyone to have someone in the room that she doesn't want to have there. It's good that she look at that birth plan as an ideal because stuff happens. Whether she's planning for a home birth and may need to be transferred to a hospital. Maybe she's going to be in a hospital in a laboring wing and she ends up having to have a C-section, a cesarean section. These are decisions she wants to make in advance as to what's going to happen. And this is where the real value of a doula comes in, because while the mom's in labor, the doula can be the advocate for the mother. No, this is not what she wanted. Yes, this is what she wanted. And then the mother supersedes everything. If the mother says, I don't want that anymore, I want something different now, then the doula steps back and lets the mother step up. But the doula is there as a representative of the mother, so the mother can focus on laboring, and this person can help support the delivery. An epidural is a pain medication where they numb the body pretty much from the waist down, and it does limit the mother's experience of the birth, and it does reduce pain. There are certain times in the labor and delivery when it can be administered, but if it gets too far into labor and delivery, it can't be. So a woman can't say, no, 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 yes. She may not say yes in time before it cannot be administered. A C-section is a cesarean section. If it's an emergency C-section, the mother may not have any say in that. If there's some reason that they identify that they need to do this to save the life of the mother or the child, they may do that. Some women plan for C-sections. Some women who know they have a particular challenge. I know a woman who had what was called a non-responsive cervix, meaning, it was a non-responsive cervix, and it never ripened, it never opened, it wouldn't dilate. And so she knew with her first one, it was an emergency C-section because she went through labor and it didn't progress, and they ended up having to take the child. With her second child, she began the labor, but there was no sign the cervix was ripening, so they did the C-section. With her third child, she planned it because she said, it's failed twice. I'm not going to not go through that. The important part for a practitioner is to support our clients to make the best decision for themselves, not to make the decision that I would be making if I were in their position. So you may have an opinion on planned C-sections or an opinion on epidurals or an opinion on a hospital birth, but it's important that unless your client asks for that opinion, it stays your opinion and you don't have to share it with them. If it's a male child, the decision about circumcision will come up. This is something that's done in the hospital very shortly after birth, and so the parent wants to be prepared for whatever their decision is to follow through with that. Vaccines, oh my God, what a big issue that is. So parent wants to decide. Some vaccines are administered in the hospital immediately after birth, and the parent wants to make sure they've included in their birth plan what they're approving and what they are not approving to be done to their child in the hospital. And even though people in the hospital will tell you this is the way it has to be done, it doesn't. The parent is in control 100% of the time. If it's an emergency situation where the child's life is at stake, then they may supersede the parents. But for the most part, even then, the parent can say, no, you're not doing that. With a home birth, you've got a lot more freedom to make decisions, a lot more freedom about where you labor and how you labor. And the challenge there is just make sure you have a midwife I had a registered nurse midwife, along with she brought a second midwife because my registered nurse midwife was a good friend of mine, and she wanted to make sure that she was not making decisions out of friendship. She was making them as a midwife. So I had two midwives, and I felt very supported and cared for. And there was one time where there was a question about at what point do we consider that this is a problem, and it wasn't a problem. With the mind, postpartum support. During the third trimester, you want to get together those people, the crew that are going to help you through postpartum time. Each family is different. Their structure, if the parents can take time off work, who do they have who's going to be there to support the mother after? This fourth trimester, which is kind of an oxymoron, is an important time for bonding with the child, establishing first chakra safety. This is safety, security, tribe. So during this time, the child is going to be introduced to their tribe, and they're going to learn about their safety. So having the parent present during this time is very important because that's where the bonding is going to begin. That's where the child begins to recognize who they are, where they belong, and how loved they are. It says, see more below, so I'm sure this is going to be coming up. Oh, I know, because we're going to be looking at a whole section on postpartum care, and that's going to be part 3 of our pregnancy lecture here. Pregnancy lifestyle, birthing horror stories. I do not have any idea why women do this, but they do. If they have a birthing horror story, I have a sister-in-law who was in labor for 31 hours and they strapped her to some kind of device and they turned it upside down. I don't know. It's a horrible story. And she tells it at every baby shower and every birthing event to let people know that this could be really bad. I'm not sure why people do that because I don't think it's beneficial for the mom. And where it says take it with a grain of salt and thank them, I would even go so far as to interrupt them and say, I really would love to hear your birthing story after mine. And then you and I, maybe we can share notes and stuff. But I don't think it does the birthing mom any good to be scared. It's important during labor and delivery for the mom to be completely relaxed and to be trusting that her body knows what to do. Women's bodies have been birthing babies since the beginning, so this is something they know how to do. And our society has made birthing a condition that needs to be hospitalized. It's made it a pathogenic or a disease-ridden process. And it's not, and it doesn't have to be. But the more fear we have, the more resistant we are, the more difficult it is for the body to deliver this baby healthfully and naturally. Birthing is a natural process. It is something the woman's body was born to do. And there are exceptions, like my friend who has the non-responsive cervix. You know, that's going to be the exception rather than the rule. And unfortunately, more and more often, women looking at this as a frightening time, as a time that's fraught with pain, as a time that's fraught with discomfort. They're creating their own resistance to it, and we're seeing an increase in cesarean section rates far beyond what we need. Kegels. Kegels are pelvic floor exercises. This can be done for strength building, but also for building awareness of the lower pelvic floor. These are the muscles that are used when we're pushing out the baby. And if we haven't been using them before, they're not going to be as strong and as toned as they could be for childbirth. So that could be a recognition here as well. Birthing classes. These are great. Kimberly's sister took a hypnobirthing class at the recommendation of a doula, and that helped her preparing for birth and delivery. It helps get the mother into that calm and grounded and fully present mind state where she can observe what the body's going through without hyperreacting to pain, discomfort. I did a class on Bradley method, which is basically barnyard maternity, which Bradley watched cows and pigs giving birth, and he said, oh, well, look, they match their breath in this way. And so the Bradley method was very big on how you were breathing, which was not doing anything like that. That's more Lamaze. Bradley method was filling the body with air and oxygen and prana and kind of vitalizing the baby and then having long, slow exhales. A doula, if the husband or partner travels for work, having a friend, someone who can be a birth partner becomes very important. This is, again, someone that the mom trusts implicitly so that she can let go of any cares or concerns at that time. There's some good books. These can be read anytime during the pregnancy. Spiritual Midwifery by Ina May Gaskin. She was the midwife at a place called The Farm, which was a commune in the 60s and 70s. And so it's got a lot of hippie lingo, but it's kind of the Bible for midwives of home birthing. Birthing from Within is about spiritual birthing. You're birthing both yourself as a mother as well as the child. And so that's a lovely book. Yoga Mama, Yoga Baby by Margot Shapiro Bachman, sorry. And I like this one. It gives you the Ayurvedic insight. It takes you through how to take care of yourself during pregnancy and postpartum care. And Ina May's Guide to Childbirth by Ina May Gaskin, again, is another option. But there are so many great pregnancy books out there. So any of these would be recommended. For the pregnancy lifestyle, we want drinking water all the time, all throughout the pregnancy. This helps the placenta and the amniotic sac form. It increases rasa, and it's going to support the movement of nutrition to the fetus all throughout the pregnancy. So this pregnancy lifestyle is all throughout. The body is made up of 80% water by weight, so this is a very water-intensive process. Even into nursing, we're moving water out. We want to make sure we have enough water within in order to feed the child. Ushnapana is drinking cooked water or boiled water in the morning to help ensure healthy elimination. This has become the 16 ounces warm water with lemon, but it's really just having it be clean, warm water. You can add the lemon to it. That's certainly going to be beneficial if the sour taste is going to help with elimination. Get a big water bottle to carry with you throughout the day so you can measure how much you're drinking. The general rule of thumb is you want a ½ ounce of water for each pound of weight. So if you get up to be 160 pounds, you're going to be taking you're going to be taking 80 ounces of water. Whereas if normally you're at 120, less water is okay. So 1/2 ounce of water for each pound of weight is going to help make sure that's the minimum amount of water that you want to be taking in. Taking a walk each day, beginning in the first trimester. This helps support muscular development, keeps the ligaments and tendons strong, and protects the body, builds strength in the circulatory system so it can contain the rasa and the rakta as it increases. You can also do strengthening the gluteal muscles, which is the backside. And Kimberly's doctor told her to do squats, taking bar classes. He said much of labor is your butt muscles, the bearing down part. So practicing that squatting, I mentioned it with elimination, using a squatty potty, but practicing squats. Some women, when they deliver, they like to be in a squatting position. And this can be difficult if they haven't practiced squatting going into it. But if they can put something, a rope or something they can hold on to, many people use the bedpost, or they might have a rope coming down from the ceiling that they can hold on to so they can support the body while they're in that squat position. There are birthing chairs which kind of put you into a squatting position. So you can look at these, but doing the daily exercise, incorporating squats and walks for aerobic, but then other muscle building, strength building exercises like squats for building strength and endurance. Daily routine, don't push yourself. Listen to your body. When it's tired, rest. When it's invigorated, move. Elevate the feet, and you could start elevating the feet even at the first trimester. The body is increasing blood at that time. You can start by supporting the body with gravitational flow. This might mean just putting a pillow under your feet while you're sleeping, but it could also be going to legs up the wall posture for a significant amount of time. Abhyanga continues. It mentions for Kapha to avoid Abhyanga during pregnancy. They could be doing Abhyanga without oil. They want to increase, they do want to get circulation going, and so I don't like to see them stop it completely. Vata and Pitta says proceed with caution, especially if preeclampsia, high blood pressure. And I'm not clear on why that is. So I'm gonna say if they're preeclamptic, do that, and then maybe you can put that into one of the questions about why, what's going on with Abhyanga with preeclampsia. Because I've never seen Abhyanga to raise blood pressure. But it may be some other connection I'm unaware of. The massage, it would be beneficial to do this without a lot of oil, because if our Agni is not really fully charged up, we'll have a difficult time processing all of this. But you can do the Abhyanga with no oil. Just warm the hands up. And then do, just like you would be doing an Abhyanga, straight strokes on the long bones, and that's going greater pressure towards the heart. Circular at the joints. Don't forget the inside of the joint. And then up the body that way. So you can do this whole thing, and it brings your own oils to the surface, and you're really doing the Abhyanga with your own body oils. Some massage strokes may be harmful during pregnancy, and it often has to do with massage strokes around the feet and the ankles. Beyond that, do research if you're going to be doing self-massage and see where there would be any kind of strokes that would not be recommended. I am not a massage therapist, so I can't speak to that. Okay, it may be helpful to moisten the skin to prevent stretch marks. So going through the process of preparing a formula such as this one, which has got lots of good stuff in it with the shea butter, apricot, calendula, dried ginger. But even during the first month, taking time to massage that into the belly. And you can do that at any time during the day. And it may help forestall stretch marks or prevent them completely. In the evening, allow yourself extra time to sleep. It can be hard to sleep in the third trimester. It's important to sleep on the sides. You're not putting pressure on the back. But it can be really hard when the baby's really big and when the baby's really active. It can be hard to fall deeply asleep and to find a comfortable position to sleep in. You can't sleep on your tummy because of the belly. You can't sleep on your back because it'll put pressure on the vena cava and block blood flow. So you're going to sleep on your side. They do have devices such as this woman's using a body pillow that would help support those parts of the body so you can get to a comfy position. You can do the same thing with lots of pillows. This is a pregnancy pillow, and it says between the legs for the entire length of the legs, which she has here, but you can modify this with things that you have at home. It's just real important to have that nice supportive nest to sleep in. And then herbally, you can take turmeric. Turmeric supports the liver. It's going to support liver function and clearing out any toxicity or excess hormones. It thins the blood and keeps the blood flow going. It removes plaques that may be forming in the blood or in the brain. So turmeric is just such a great herb. You can cook with it. You can also make a turmeric paste of it and put it into your teas. So you've got many options for ways to take turmeric.